Hello. Today, my friends and I are going to talk about gastroesophageal reflux disease, or GERD. So, before I get into the definition of GERD, I want to talk about acid reflux. It's something we've all experienced, and it's just that really uncomfortable feeling in your chest, or sometimes you taste the acid in your mouth. That is an acute issue. So, it only happens every once in a while. GERD is a chronic digestive condition. So, people dealing with GERD are dealing with it every single day. And what is happening is there is a backward flow of stomach acid into the esophagus. And because the acid is somewhere it doesn't belong, it causes irritation, it can cause inflammation, and it results in uncomfortable symptoms. And unfortunately, it can cause potential long term complications if it's left untreated. So, treatment is really important. What exactly is happening with GERD is the sphincter, or it's like a tight rubber band at the bottom of our esophagus and the top of our stomach that separates it. It weakens over time. And later on, the risk factors that contribute to that will be gone over. But because that weakens, the acid is able to flow back up into the esophagus and make those very uncomfortable feelings that we get. The effects of GERD, because it significantly affects our digestive system, the heartburn that nobody likes, regurgitation, which is the acid in your mouth, or difficulty swallowing, which can be really scary because of the inflammation that happens. It can make it difficult to swallow anything. It can lead to esophagitis, which is the inflammation or the swelling. And in severe cases, there's something called Barrett's esophagus, which the picture shows the lining of the esophagus that's broken down, and you can see it looks really raw. And that can lead to cancer also if not treated. And asthma, if you have asthma, your asthma may be aggravated because there are tiny acid particles that can get into your bronchioles, and that can trigger asthma like symptoms.
All right, let's talk about some risk factors that can lead you to experience GERD. First of all, diet. Your diet and the things you eat can have an effect on you and play a role in developing GERD. So, eating things that are high in fat, like fried foods and fast foods, and drinking things like alcohol can actually relax your lower esophageal sphincter, making it easier for food to come back up. Second, obesity. The excess weight puts pressure on the abdomen, resulting in the stomach being pushed up, and then this leads to a decrease in the lower esophageal sphincter pressure. And third, smoking. The tobacco can actually relax the lower esophageal sphincter and also slow down digestion, which can produce more acid, and it also reduces the production of saliva, which isn't good because saliva actually helps neutralize the acid. So, lifestyle changes are the key to prevention. So, if diet is the reason you're experiencing these symptoms, change your diet. Find out the foods that trigger you and avoid them. And if excess weight is the reason, do what you can to lose a few pounds. And if smoking is the reason, then stop smoking. If you put in the effort, you will see the results. So let's move on to signs and symptoms. So the main symptoms of GERD are pyrosis, which is heartburn, and regurgitation. So heartburn is described as a painful burning feeling in the middle of the chest, rising from the tip of the breastbone to the esophagus. It usually occurs after having a meal and can be worse when at night or when lying down. And then regurgitation is also another common symptom. It's when stomach content like acid, food, and liquid come back up into the esophagus and up to the throat and mouth. It can cause a sour taste in the mouth due to the stomach acid. And some additional symptoms are chest pain, dysphagia, which is difficulty swallowing. So people say that they feel like there's a lump in their throat, and odynophagia, which is pain while swallowing. And as discussed before, asthma like symptoms and nausea. The symptoms of GERD typically worsen after eating or having a large fatty meal at night or when lying down or when bending down.
Some exacerbating factors of GERD, key triggers. It's going to be spicy food. Consuming spicy foods can lead to increased stomach irritation and acid reflux. Secondly, it's alcohol. So, any consuming of alcohol, drinking alcohol can relax the lower esophageal sphincter, worsening GERD symptoms. Laying down after eating, after meals can promote acid reflux and exacerbate discomfort. Some diagnostics, we have upper endoscopy, uses a small camera to look inside the esophagus and stomach, and this can check out any damage, take biopsies, or stretch narrow areas. Secondly, we have X-ray of the upper digestive system. which would be consuming a barium swallow. This uses a chalky drink to show the shape of the esophagus and stomach. Also helps find narrowing or swallowing problems. Ambulatory acid pH probe test measures how often and how long the stomach acid enters the esophagus. Um, Esophageal manometry. This measures how well esophagus muscles and sphincter work during swallowing. And lastly, transdermal esophagoscopy, a small camera through the nose to check for damage in the esophagus.
Some interventions to GERD include lifestyle modifications, nursing interventions, and pharmacological therapy. For lifestyle modifications, we like to encourage patients to elevate the head of the bed 6 to 8 inches while sleeping. We like to encourage them, instead of eating big meals, to eat small, frequent meals and to avoid lying flat for 2 to 3 hours after each meal. We like to encourage them to avoid trigger foods, encourage weight loss if overweight and obese, and encourage them to stop smoking and limit alcohol intake. Some nursing interventions for GERD include assessing frequency and triggers of symptoms, providing patient education and diet and lifestyle changes that could be made, administer prescribed medication, teach proper medication timing, and monitor for complications as well. Some pharmacological therapy that we use is antacids for quick relief, H2 blockers, which decrease acid production, proton pump inhibitors, which we like to give 30 to 60 minutes before meals, and this is an acid suppressor. It's the strongest of them all. TLERs are like baclofen, are used to decrease reflux episodes. And then bethanyl chloride is a reflux inhibitor that we like to use, as well as sucralfate is a surface agent that we like to use to coat the stomach lining. Some nursing and self-management strategies for GERD include dietary changes. Adopting a healthier diet can significantly reduce GERD symptoms. This includes avoiding spicy foods, citrus, and fatty meals. Incorporating more fruits, vegetables, and whole grains into a patient's diet helps support digestive health and minimizes acid reflux occurrences. Keeping a food diary may also be beneficial for a patient to help identify personal triggers for that patient as well. Weight loss. Maintaining a healthy weight is crucial for managing GERD. Excess weight can increase abdominal pressure, pushing stomach contents from the stomach back into the esophagus. A gradual weight loss approach through exercise and balanced nutrition can be effective in alleviating symptoms and promoting overall well-being of your patient. Elevating the head of the bed is another intervention that we like to use that a patient can use at home. Sleeping with the head of the bed elevated can prevent nighttime reflux episodes. You can do this by using extra pillows or a wedge, and this helps keep acids in the stomach where they belong rather than coming into the esophagus. This small, simple adjustment can aid in reducing discomfort and improving sleep quality for those affected by GERD greatly.
For follow up care for GERD, first we have to avoid certain medications that irritates our GI tract. We should avoid using medications such as naproxen, ibuprofen, and aspirin. For this, medications do irritate the GI tract. For pain medication, it is advisable to use acetaminophen. For diet, we should eat food that aids in preventing acid reflux. Eating fibers such as oatmeal, sweet potatoes, green beans, beets, and broccoli helps us to feel full, which prevents heartburn that contributes in GERD. We should also eat food with high alkaline levels, such as nuts, bananas, and melons. This offsets the strong stomach acid. Eating foods with high water content does dilute and weaken the stomach acid. The use of home remedies alleviate GERD as well. Instead of using antacid, which can be bought over the counter, these foods offer relief, such as non-fat milk, ginger tea, and honey lemon water. For community resource for GERD, we have San Joaquin County Public Health, which offers resources and programs to support individuals with GERD and promote overall digestive health. We can also call 211. It's a San Joaquin service that leads us for referrals for local hospitals, or we can also download the 211 SJ mobile app. We can also access things such reliable online resources such as CDC and Mayo Clinic, and these are trustworthy resources that can provide information with GERD.